Hi, it's Jeff here from Insight, here to talk to you about our check series of ultra-brief intervention tools. As you can see, there are 5 tools in total covering opioids, benzodiazepines, methamphetamine, cannabis and alcohol. Let's look at them in greater detail. These ultra-brief intervention tools have been designed for clinicians or practitioners who often only have a short or opportunistic time to have an intervention with a client or patient, such as GPs, hospital staff, or people in non-tertiary treatment settings. However, they can still be used in any situation, particularly for the first or initial appointments where we're not sure if our client or patient is going to engage in longer or ongoing treatment. Before using any of the check tools, we really recommend that you spend some time familiarising yourself with all of the different sections and activities. This will really help with the flow of the conversation. You may also want to skip some sections or add your own bits that you think are helpful, so it's useful to have it all planned out in your head beforehand. We expect the tool to take anywhere between, say, 10 and 20 minutes to complete, depending how complex or engaged the client or patient is in the session. Before commencing a session with a patient or client, we recommend that you have a quiet space and enough time to go through it, that the client is in the right headspace, they're not in a race to go or distracted by other people, and that they're not too intoxicated or impaired to follow the conversation. You'll also need a pen or pencil if you want to write on the tool, and a calculator will be handy for one of the activities, so get these ready beforehand. Naturally, you should ensure that you have the client or patient's permission to do the exercise beforehand, and that you've considered all other risks, safety, consent and confidentiality issues. Please also note that this tool is not intended to replace a full clinical assessment, and that the patient or client should be reassured that they can stop the conversation at any time and take a tool away to read at the later date. You can follow the tool in the numbers of each of the boxes if you like, or as mentioned earlier, chop and change depending on the sequence that works best for you. All of the tools tend to follow the same basic structure, but there are some differences, so please familiarise yourself with each tool beforehand. Most of them start with some basic information or psychoeducation principles just to start up the conversation, but some tools start with a screener or a table to work out how much the client is actually consuming or using. Most of the tools, except for the benzodiazepine one, has a calculator exercise. Here you can talk to your client and patient and work out roughly how much they spend each week, month or year on the substance, remembering to average out how much they spend on a big night out if they drink or consume in a binge pattern. Remember, some patients or clients might say that they get their substance for free. If this is the case, ask them how much they would have spent should they have had to have paid for the substance to get the same result. All of the activities have what's called a decisional balance, where you can talk about the good things and not so good things about that substance use for that person. Remembering to ask a lot more questions around some of those negative factors, as that's probably the reason why they're talking about that substance with you in the first place. After that, we have readiness to change rulers, where you can ask how worried they are about their substance use and how important it is for them to make changes. And you can go on and ask what it would take for their score to go up or down on each of those particular rulers. The back page of each tool tends to follow the same structure, where we run through a list of good harm reduction tips that they might already be doing or might consider trying in their life. Then, on the right-hand side of the page is tips for people who are thinking about cutting back or quitting, and a space to write down their plan. The alcohol tool has an extra exercise on the back, where you can ask your patient about what they enjoy spending their time doing, or activities or other things that are important to their life other than drinking. We encourage you to pay particular attention to the red warning boxes, which are located on some of the tools, as this contains critical medical warnings around risks of seizures or overdose. All of the tools list the National Drug Hotline number, so they can be used in any state or territory across Australia. So that's our check series of tools. If you'd like a copy, you can download them from our website or contact us if you'd like to purchase packages for your service or clinic. And we'd love to hear your feedback, so get in touch if you've got any comments or thoughts. Thanks and bye for now.